Tender Rock Counseling is a Christ-centered, specialty-oriented, multidisciplinary, team-based, and outcome-based counseling center. This approach is guided by two main concepts: counseling effectiveness and cost efficiency. Christ-centered does not mean that Tender Rock Counseling is a Christian counseling center. It means that Christ is the center of the values in our life and in our counseling work. Tender Rock Counseling provides services to people of all religions, ethnicities, genders, ages, and cultural backgrounds. Tender Rock Counseling is specifically committed to functioning as a conduit through our actions rather than preaching. Being a conduit means that, first, we see ourselves not as healers, but as consultants, and view our relationships with people who seek our counseling services as consultant-client instead of doctor-patient. Second, we know our own limitation as therapist and view the client as the expert of his or her own life who has the capability to choose or the capability to learn to choose best for themselves. According to this perspective, the clients are the best people to make meaningful changes in their lives. Tender Rock Counseling, each practitioner on the team has the experience, training, and other credentials to qualify him or her in a specific specialization, such as complex trauma of children and adolescents, ADHD, marital discord in an interracial marriage, and loss and grief, etc. Our research is conducted constantly through outcome-based practice. With the assistance of an in-house research staff, all the measurements we collect from the monitoring process allow us to constantly examine our counseling effectiveness and to make efforts to improve counseling approaches at both the individual practitioner and team level. We also are committed to share the learning and improvement efforts from our ongoing research, not only with the domestic community through the professional medical mental health field, but also the international community through publications, training classes, and seminars. Tender Rock Counseling commits to make constant efforts to assemble in-house specialists as well as other affiliated specialists of different disciplines who are capable to work collaboratively through our unique electronic data management system and collaboration meetings as a team together. Tender Rock Counseling's team is formed with various practitioners, led and coordinated by a lead therapist and dedicated to the clients with specific needs. Collaboration and integration are the cornerstones guiding our unique, specialty-oriented, and multidisciplinary team-based practice. This is what differentiates Tender Rock Counseling from many multidisciplinary practices comprised of different therapists with different backgrounds working at the same location for business-driven purposes such as referrals, networking, and expense sharing. By contrast, Tender Rock counselors work as collaborative teams for the purpose of counseling effectiveness and cost efficiency. Collaboration is a rare commodity in the healthcare fields. As a result, collaboration becomes something more talked about than implemented. For Tender Rock Counseling, collaboration means two things: attitude and actual efforts. Attitude is a reflection of our belief that collaboration is the most important catalyst for effective counseling and cost efficiency. Actual efforts are specifically implemented throughout the team-oriented process, and they include team consultation meetings, electronic document management systems, and monitored outcome measurements that come directly from the client's input and feedback, which gives team providers scientific basis to adjust their plans for treatment. Our approach is integrated as it is reflected in our comprehensive assessments covering the body, mind, and spirit domains, as well as in our counseling interventions in which, depending on the type, severity, and duration of the issues, the team members work collaboratively towards different domains using an integrated perspective. The integrated perspective allows the team and the client to see the big picture of the connected body, mind, spirit, and to approach the counseling issues accordingly. In the beginning of our multidisciplinary team-based process, clients will be matched with an experienced team lead therapist trained to understand the client individually and systematically. This team lead therapist also works as a manager for the client. The lead therapist will first conduct a comprehensive bio, psycho, social, and spiritual assessment. Then a counseling plan is developed. As part of the counseling plan for the client with ADHD, the lead therapist, through consultation with the team, may recommend psychological testing, individual counseling, group counseling, neurofeedback training, medication, educational consultation and tutoring, or diet consultation. The above counseling plan and team formation would be discussed with the client and/or client's parents in consideration of maintaining a balance between counseling effectiveness and cost efficiency while meeting confidentiality. Effectiveness of counseling is a primary goal of our collaborative team-based counseling approach. The client's input and feedback through collaboration is the best way to measure the effectiveness of counseling services. Therefore, by monitoring and routinely measuring counseling outcomes, clients' input and feedback, and adjusting the practice accordingly, we form our outcome-based practice. To understand our multidisciplinary approach in more detail, please contact our Counseling Center for a free 1/2 hour consultation.